Good morning, everybody. When I walked in the room, I saw Sheila, and of course, the first thing I said to her, because we met here in 2009, was, do you have your little balls with you? Everybody knows Sheila has the most compelling balls when talking about medical imaging. Well, for those that don't know me, my name is Andrew Spiegel. I am the Chief Executive Officer of the Cancer Alliance, which is the oldest and the largest national patient advocacy organization dedicated to colorectal cancer. And we are on the forefront of cancer in America, and it's our job to save lives and prevent deaths that are caused by colon cancer. I'm proud to stand here today with fellow advocates and with all of you, those who are fighting cancer and heart disease, and those who are survivors who have beaten disease back, and doctors and caregivers who are helping those battle the disease. And thank all of you who are spending your time and your energy here to help this journey from diagnosis to treatment to being disease-free. And as a representative of the Colon Cancer Alliance, I am proud to join all of you and my fellow advocates here to talk to our elected officials, to tell them that we don't want cuts to medical imaging. We don't want radiology benefit managers to interfere with the relationship between doctors and patients. Today we gather to speak up for the millions of patients who are alive today because they had access to the right scans at the right time. And we stand here to speak for the millions of others who will need health information down the road, information that you can only get from a CAT scan or an MRI or a PET scan. We're here today to speak for the mother whose MRI of the breast may show that she may be able to avoid radical surgery because they can detect smaller things with better imaging. We gather here today for the father who needs a chest CAT scan, which will help the doctor determine whether that blockage is as bad as they thought, or maybe he'll need immediate surgery, things that you can't determine without medical imaging. We're here today for the person who wants to get colon cancer screening, but can't or won't get a traditional colonoscopy, but could and would get a virtual colonoscopy if Medicare would pay for it. And we're here today for the aunt and the uncle and the grandparent and the cousin whose PET scan will tell the oncologist that there is hope, that the therapy is working, and that the family member will be doing better. Reimbursements for medical imaging, as Tim said, have been cut 8 times in the last 6 years. And today, even the advances made in how imaging saves lives and money, like Sheila showed you, imaging use has declined for 2 straight years. You have this phenomenal technology that's getting better and better, and the use of it is declining. And that's why we're here today. We're here to tell our elected officials that they have to preserve access to medical imaging. We're here to tell them that cutting Medicare reimbursements too much, too fast, will have a devastating repercussion on patients, those in the Medicare program, and this will affect people with private insurance too. So access to health benefits, screening, early diagnosis, they all deliver better results because of advanced medical imaging. And that's why we have more than 20 patient groups who have signed on to that letter, and I know you've all seen that letter. More than 20 patient groups from every major disease known have joined together to send a message to Congress to, number 1, reject the massive cuts to medical imaging. And number 2, stay out of our doctor-patient relationship. We don't want government bureaucrats telling our doctors whether they can order that scan for us. That's up to the doctor, that's up to the patient.
Yes.
Reject radiology benefit managers. So we're at a time when, as a society, we're encouraging preventative care. That's what the Affordable Care Act is supposed to be all about, preventing disease to begin with. But if that's the case, why are we considering a public policy that will do the opposite? A public policy that will threaten the very access to preventative tools that this act is designed to prevent. It's just the wrong approach. So as the voice for patients across the country, we encourage legislators and administration officials to recognize the vital role that medical imaging plays in the lives of patients. Help us save more lives by ensuring seniors have continued access to advanced medical imaging. Thank you.